Good evening, doctor. I'm Rihan Khadar from Group 2A, and today I'm going to talk briefly about Lichen Planus, its definition, etiology, signs and symptoms, types, diagnosis, differential diagnosis, and its treatment. Lichen Planus is a common chronic inflammatory disease that affects oral mucosa with or without skin involvement and other mucous membrane. It's more common in middle-aged females. Its etiology is unknown, but it can be considered to be an immunologically mediated process, or it can be related to genetics triggered by emotional stress or hypersensitivity. Its signs and symptoms can be either oral or dermatological, or both. Dermatological features may include purple pruritic papules, which affect the flexor surfaces of the arms, legs, and the trunk, as we can see in these pictures. While oral manifestation may be asymptomatic or present as bilateral symmetrical white lesions. Most frequent site is buccal mucosa, but it can affect other sites too, as tongue, gingiva, lip, and vestibule. But the least frequent sites to be are on the floor of the mouth and the palate. We have multiple types of oral lichen planus. First one is the reticular type. It's the most common type, which manifests as white, lacy streaks known as Wickham's striae, as we can see in these pictures. It might seem like leukoedema, so we have to do stretch tests for diagnosis. Second, we have the atrophic type, which is the second most common type after reticular type. It's red in color, it causes pain, unlike the reticular type, which is painless. The most common site is the gingiva. It's presented as the sequelative gingivitis. We have also the plaque-like type, which present as white plaques resembling leukoplakia. We have papular type, bullous type, and erosive type, which is the most dangerous. It's most painful to the patient and might cause difficulty in mastication, bleeding, suffering during swallowing. It's less common than other types and may occur in multiple areas or in one area, such as the gingiva, and the stria may be seen near these lesions. The erosive lichen planus is the most dangerous because it might transfer into malignancy. Diagnosis. The diagnosis of oral lichen planus may be through clinical features like Wickham's striae and the dermatological features like the purple papules. Incisional biopsy might be used too, and it shows a dense band-like of T lymphocytic infiltrate subepithelium. Biopsy is also necessary to exclude dysplasia in the erosive type. Differential diagnosis with lichen planus. First, we have lichenoid reaction. How can we differentiate between lichen planus lesion or lichenoid reaction lesion? Lichenoid lesions are mostly unilateral in comparison to the usual bilateral appearance of oral lichen planus, and can't be associated with other skin lesions, and usually it's close to amalgam dental restoration. Many of lichenoid lesions resolve after the restorations are replaced. Second is leukoplakia. Leukoplakia can be differentiated with oral lichen planus by skin involvement في oral lichen planus and its bilateral presentation, and of course by using incisional biopsy to see if there is dysplasia or not in the case of leukoplakia. Third, we have leukoedema. Leukoedema we can differentiate it with lichen planus by simple stretch test, which disappear if it was leukoedema. Finally, we have cheek biting. Cheek biting is a wide area on buccal mucosa where the teeth occlude, which means it's traumatic, not inflammatory, as lichen planus. Finally, the treatment of lichen planus. First, we have to exclude hypersensitivity reaction to food, dental products, or medication. Then, if it was painless or asymptomatic reticular type, then no need for treatment. We can use topical corticosteroid and analgesic mouthwash in the erosive type, and oral carcinoma in the erosive lichen planus should be regularly reviewed. Thank you for listening. I hope you enjoyed this brief explanation. Stay safe.